to reopen things. Here's the county judge.
Good morning. I want to start with an update of the case count since yesterday. As of yesterday, Sunday, we have, since then, we have 47 new cases to report in areas of Harris County outside of the city of Houston. And unfortunately, 3 people have lost their lives, 3 additional people in our parts of town due to coronavirus. In total, then, we have at least 4,800 cases, at least 79 deaths. We'll see what the city of Houston reports today, but that's the latest information on our end. Last week, we started seeing encouraging signs, and I shared them with you guys. The fact that we've been seeing a rise in hospital intakes, and then it looks like the curve has flattened. That's because of the progress we've all made together. But the difference between surviving as a community and setting ourselves up for a devastating second curve is on you. It is on each of us. We've been able right now to mitigate the possibility of a higher curve, but we're not out of the woods. And so we'll continue to go through this information together. But essentially, you can see the intakes flat. And if we all do our parts, eventually that will fall down and we'll be in a place to begin lifting our restrictions. But how quickly we do that will depend on each of you to continue to stay home so that that curve actually hits its peak and lower. If we work together now, the sum of each of our parts, it's what's going to get the economy back on track and get that peak to hit and the curve to come down. To help our community, we've expanded testing criteria in Harris County. So I want to remind folks, if you are asymptomatic but you feel you've come into contact with somebody who has the virus, if you think you may have it, you can get tested. Visit readyharris.org. If you are a first responder of any kind, you take priority if you don't have symptoms. And so reach out, go to Ready Harris, and we will be there for you to make sure you get tested. We're still very much in the thick of this fight. From the moment I wake up every morning to the second I close my eyes at night, I'm thinking about saving lives, and I'm thinking about how quickly we can get through this to get the economy back on track. And every time I hear of a new death, every time somebody loses their lives, gets sick, loses a loved one, I think about how all of this, each of those deaths can be prevented to the extent that we stay home and stop spreading the virus to other people. My only priority is preventing those deaths. But of course, getting the economy back on track is another one. So this is a top one, but building a strong economy, building a resilient community has always been a priority. I ran for office to protect the American dream, to make sure that everybody had an opportunity at that dream, that we were breaking down barriers to the American dream. And so we were working on early childhood education and transportation. We were working on equitable flood protection. And all of these issues have come to the forefront. We've got folks who can't access test site because of the lack of transportation. We've got workers who can't work, and we had to step up there and make childcare more available because they were having to stay home with their kids. And so I don't want these issues to be exacerbated on my watch. I want to do everything I can to ensure that at minimum we were where we were before this crisis in terms of all of these different issue areas and obstacles that stand in the way of people's full potential. And at best, we do a little bit better. And so, as we lead the response to this crisis, and I continue to focus on protecting lives, we need someone who will be laser focused on helping families right now and combating the long-term economic effects and the long-term human impacts of this crisis. Now, the mayor and I have been working on that, and our teams have been working on that since the beginning. That's why we established a system for people living in homelessness who were COVID positive, for them to be able to isolate. That's why we established childcare for essential workers and financial support. That's why at the county we invested $10 million for small businesses, why we've worked with the judges on evictions, why we've taken so many of these steps. But we want to do it in a way that is more coordinated, and we want to make sure that there's somebody that wakes up every day thinking exclusively of this. That's why Mayor Turner and I are establishing 2 relief and recovery czars to lead our relief and recovery with a range of stakeholders. We've been in close touch about this over the last few weeks, and we have each selected one person. We'll both be announcing our czar today. I will announce the county's czar right now, and the mayor will announce his later this afternoon. And the goal of this is to make sure that our relief and our recovery is inclusive, that it's fast, and that it is coordinated. Just with any natural disaster we've dealt with, it will take years to fully recover from this. It will take talent, it will take creative thinking, but thankfully we have that in Harris County. And so we need to make sure that our recovery, that our relief is more than about getting our economy back and running. Yes, we need to do that, absolutely, but we need to make sure folks don't fall through the cracks. So we'll be focusing on coming back throughout all sectors of our economy, including small businesses, minority-owned businesses, women-owned businesses, those underserved areas. And inclusive recovery means recovery for businesses themselves, but also for the workers. That includes everyone, including the undocumented community, including every worker in this county. This is about ensuring that we have the conditions to thrive, that food distribution is adequate, and we continue to work on that, that there be adequate access to education, to the internet, for example, for children who need to continue learning online, because we know that even when we lift the order, social distancing will have to continue for quite a while. So our recovery has to be inclusive. Our recovery needs to be fast. We won't recover overnight, and we won't see relief overnight. But the reason we want to start now in the thick of this crisis, and why we've already started with so many of these measures, is because people can't wait. Every day that passes, folks struggle. It's another day of misery and stress. The impacts to the community are huge, and we're lucky there are resources available now, like our $10 million small businesses program from Harris County, like the millions of dollars that have been available through the generosity of this community from the COVID-19 Recovery Fund that's being run through the Greater Houston Community Foundation and the United Way. But we need to prepare for the onslaught of new initiatives and make sure that this is done quickly. And finally, our relief, our recovery efforts need to be coordinated. We have to look holistically, breaking down silos, making the most of every single dollar, whether it comes from the federal government, from the state government, or locally. We know, just as with every disaster, there are many programs and funds flowing down, and we need to ensure that we're laser focused and ready to get the most funds into this community as quickly as possible. And that takes navigating of bureaucracy, of coordination, communication, and that's what we're going to focus on. Now, let me stress that this is about relief and recovery. The fact that we're naming a czar does not mean the crisis is over. We're still responding to this. We still have not hit the peak. We've been working on feeding, on childcare, on homelessness, on economic resilience. But the truth is, saving lives has been my #1 priority, and I want to make sure that none of these issues fall to the background, even as we respond to the crux of the crisis, which is why my representative and the mayor's representative will ensure that they don't. And so today, I am pleased to announce Texas State Representative Armando Wally as our selection for Harris County's Relief and Recovery Czar. Representative Wally was elected state representative in 2008. He represents the Aldine area and knows the struggles that families in unincorporated Harris County face every day. He is a leader in our legislative delegation. He's a member of the House Committee on Appropriations. He's the vice chair of the key appropriations subcommittee on Article 3, which is public and higher education. He's a member of the appropriations subcommittee on state infrastructure, resiliency, and investment. He serves as a member of the House committees on higher education, redistricting, local and consent calendars. He served on several committees, including energy resources, human services, business and industry, and others. Most importantly, he is no stranger to working on these kinds of issues. Even throughout this crisis, he's been leading when it comes to protecting our families. He has led at the legislature in issues of health, safety, and economic well-being of families. He was raised by a single mother, the oldest of 5 children, and was the first in his family to graduate college. Armed with all of that experience and life experience, he's become a champion for the important priorities that we want to make sure are in the forefront of this relief and of this recovery. Mayor Turner and I have been in close communication, and as I mentioned, he will announce his counterpart later today. And so I am so pleased, Representative Wally, that you have stepped up to lead this. You have my full support and my full confidence to lead our community into an adequate relief, adequate recovery, and make sure that you and the mayor's nominee and appointee are bringing together leaders throughout our community to ensure that we are responsible and aggressive and smart in our recovery. I'll repeat my remarks in Spanish, and then we'll hear from Representative Wally. We'll take some questions afterwards. Dr. Shaw is here to respond to questions, of course, the representative and myself. Repito brevemente en español. Desde el día de ayer hemos recibido información de 47 casos nuevos en el condado Harris, fuera de la ciudad de Houston. 3 personas han fallecido desde ayer en estas áreas también. Entonces ya van más de 4.800 personas documentadas con el virus y más de 79 muertes. Ya veremos qué va a reportar la ciudad de Houston en cuanto a sus números el día de hoy, pero esa es la última información que tenemos disponible. La semana pasada empezamos a ver señales positivas, que ya la curva dejó de subir, hemos llegado a un aplanamiento realmente de la curva. Ahora lo que falta es llegar al pico. Todavía no sabemos si ese es el pico o si va a continuar subiendo. Pero la diferencia entre la supervivencia de nuestra comunidad y el riesgo de una segunda curva está en usted y en todos nosotros, el asegurarnos y mantener que ese aplanamiento que estamos viendo termine siendo un pico, más no simplemente un nivel antes de una segunda subida. Si seguimos trabajando todos nuestros esfuerzos, la suma de esos esfuerzos va a permitir que podamos salir adelante de esto. Síguense quedando en casa. Si hacen eso, a medida que hagan eso, esa curva va a empezar a bajar y ahí sabremos que hemos llegado al pico. Entonces, puede que estamos cerca del final, pero eso depende de su esfuerzo, quedarse en casa y distanciada de otras personas. Quiero recordarle a todos los residentes que hemos expandido los parámetros en nuestras sedes de pruebas. Entonces, si cree que pueda tener el virus, puede ser evaluado. Visite readyharris.org, aunque no tenga síntomas. Y si usted es médico, policía, trabaja en cualquiera de esas áreas, también usted tiene prioridad. Entonces, búsquenos en readyharris.org y nos aseguremos que reciba su prueba. Seguimos 100% en medio de esta crisis. Desde que abro los ojos en la mañana hasta que los cierro a la hora de dormir, estoy pensando en cómo salvar vidas. Cada una de estas muertes que hemos recibido el día de hoy, la información que recibimos, todo eso pesa en mí porque son prevenibles. Son muertes que podemos prevenir si mantenemos ese distanciamiento social. Yo decidí postularme a esta posición, a la política, para proteger el sueño americano, para asegurarnos que cada uno de nosotros tenga la opción de llegar a nuestro potencial máximo. Es por eso que estábamos trabajando en iniciativas de educación temprana, en expandir el transporte y transporte público y en otros temas similares. No quiero que durante esta crisis retrasemos el progreso que ya habíamos hecho, empeoremos la situación para las personas. Entonces, aunque yo sigo con la prioridad número 1 de salvar vidas, también proteger la economía, es importante para mí que haya alguien 100% enfocado en proteger el lado humano, la resistencia económica, el cuidado de niños, la habilidad de personas a acceder a comida, la accesibilidad de las escuelas, ahora que esto es por internet y probablemente lo será por un buen tiempo dado a las necesidades de distanciamiento social. Hemos estado trabajando en todos estos temas con el alcalde en las últimas semanas, hemos estado trabajando en tener sitios de aislación para personas sin hogar que tengan el virus y necesiten aislarse, hemos trabajado en cuidado para niños, para familias, trabajadores esenciales, los 10 millones de dólares que otorgó el condado a pequeñas empresas, el trabajo en los desalojos, todo esto, pero queremos coordinar aún más y tener una persona que esté enfocado el 100% en este tema de recuperación y de alivio. Todavía tenemos que aliviar los impactos en la comunidad y también tenemos que recuperarnos cuando pase esta crisis. Entonces, vamos a nombrar 2 zares, 2 líderes, uno por parte del condado, uno por parte de la ciudad de Houston, para que trabajen en el alivio y la recuperación de la crisis. Esto debe ser, las iniciativas que ellos lleven a cabo, debe ser primeramente inclusivas, incluir a toda la comunidad, rápidas también y coordinadas. En el primer punto, queremos asegurarnos que no solamente los negocios se recuperen, claro que sí, los negocios tienen que salir adelante, pero también los trabajadores, incluyendo los trabajadores indocumentados. También necesitamos asegurarnos que haya suficiente comida, que podamos distribuir como sea necesario de la manera más eficiente, que nuestros niños tengan acceso al estudio, al internet que necesitan, apoyar la educación y apoyarlo a través de la comunidad. La recuperación, el alivio debe ser rápido. No podemos esperar. Cada día que pasa, que estamos todos sufriendo, son tragedias, catástrofes no solamente financieras, sino también salud mental de toda la familia y por eso debemos trabajar para que esto sea lo más rápido posible. Y finalmente, tenemos que asegurarnos que estamos coordinando. Vamos a recibir y ya hemos recibido ayuda de varios niveles de gobierno, federal, estatal, el trabajo local. Todos estamos compitiendo por esos recursos. Entonces, es importante que el condado Harris esté preparado para recibir esos recursos, para asegurarnos que estamos recibiendo la cantidad máxima por la que calificamos, que no dejemos nada en la mesa, sino todo sea implementado de una manera coordinada. Vamos a necesitar ayuda y creatividad de todos sectores en la comunidad, pero lo bueno es que esa creatividad, esa participación existe, solo necesitamos a alguien que ayude a coordinar. Es por eso que estamos nombrando a este zar, a este líder. Quiero recordar que el hecho de que estemos trabajando en recuperación, en el alivio, no significa que la crisis haya pasado. Seguimos en ese nivel aplanado, no sabemos si es el pico o es el principio de otra curva, pero queremos priorizar esto también. Entonces va a ser paralelo el trabajo. Me enorgullece nombrar a el representante del condado. El alcalde Turner estará nombrando a su representante esta tarde. Hemos estado en comunicación muy de cerca las últimas semanas, eligiendo estas 2 personas que van a liderar el alivio y la recuperación. El representante por parte del condado es el representante estatal Armando Wally. Realmente es para mí un honor, un orgullo nombrar al representante Wally. Él fue elegido representante estatal en el 2008, representa el área de Aldine y conoce muy bien las vidas de los residentes del condado Harris, particularmente aquellos que viven fuera de cualquier ciudad. En este momento es un líder en el gobierno estatal. Él es miembro del Comité de Asignaciones de la Cámara de Representantes, un comité muy importante. También es el vicepresidente del Subcomité de Asignaciones sobre el artículo 3, el cual lidia con la educación pública y la educación superior. Trabaja en comités de educación, de calendarios locales, ha trabajado en áreas de energía, de negocios e industria, todo tipo de temas que son muy relevantes a el proyecto ahora que él va a estar liderando. Más importantemente, el representante conoce este tipo de retos que enfrentan las familias. Inclusive durante esta crisis ha estado ayudando a familias a acceder a comida, cuidado de salud. Ha trabajado por muchos años en apoyar a las familias, al bienestar económico y al bienestar universal de las familias. Él fue criado por una madre soltera, mayor de 5 hijos, fue el primero en su hogar en atender y graduarse de la universidad. Trae todas esas experiencias a este proyecto y sé que va a ser un increíble líder en este grupo. Entonces, el representante Wally tiene toda mi confianza, todo mi apoyo para llevar a cabo este esfuerzo de recuperación y de alivio mano en mano con el representante del alcalde Turner y las personas que ustedes decidan nombrar a este grupo de recuperación y de alivio. Thank you so much. I'm going to, we'll hear now from Representative Armando Wally, and then we will take questions. Representative Wally.
Thank you, Judge. Good morning. It might be afternoon now, but just wanted to thank you, Judge, for your leadership, and Mayor Turner also for their collaborative efforts in trying to get our region back to recovery. But just wanted to thank you, Judge Hidalgo, for appointing me to chair the Harris County's recovery effort from the devastating impacts of the COVID-19 virus on our region. While we are in the midst of a public health crisis, it is critical for our decision-making to be driven by, 1, data, and 2, judgment of our public health experts on how those decisions will impact the people of the greater Houston region. And thank you, Dr. Shaw, for all your work. We expect to work with a wide variety of regional stakeholders in this effort, including from the private sector, philanthropy, faith-based organizations, nonprofits, and local governments, from the city of Houston to all our smaller municipalities, and including our unincorporated part of the region, which is about over 2 million people in unincorporated Harris County. We need to work together on an inclusive recovery that responsibly ensures the health and economic well-being of the people of Harris County. We need to save lives and also save livelihoods. As a lifelong resident of Harris County, I've gone through a number of natural disasters with all of you. And one of the things I love about our people in this region, that in the aftermath of a crisis, we always come together and we always emerge stronger than before. This crisis is dire and it's serious. But we have an opportunity here to show the country how to move forward. I look forward to working with our partners at the City of Houston and leading this effort to work together in bringing needed resources to the area and put the region back on the road to recovery. I want to thank my wife and my kids. I've been homeschooling my boys the last couple of weeks. They're probably sick and tired of me, actually, but I do want to thank my wife, who's also a healthcare professional, works in a hospital setting. But I want to thank the people of this region, the people of Houston, Harris County, for giving me this opportunity to give back in a much different role than I have in the past, and that is as a member of the Texas legislature. And so with that, I'll take any questions, but at this point, I understand that Dr. Shaw may have some comments as well. But I just want to thank you, Judge Hidalgo, for the opportunity to serve this great region. And God bless you, and continue to follow the guidelines of distancing 6 feet away from folks. And when you're actually using masks, don't touch The middle part, as my wife says, make sure you adjust them correctly, but make sure you practice social distancing. Make sure you follow the rules of our healthcare experts, because anything that we do in the recovery is predicated on the advice and consultation of our healthcare experts. Thank you, and God bless you.
Thank you so much. Thank you so much, Representative Wally, for your leadership. We'll now take questions for the representative, myself, or Dr. Shaw as well.
Okay. This one, if you can also please answer it in Spanish. This is for KTMD. And do you agree with relaxing social distancing and some restrictions in the coming days, as the governor plans to do?
So we've been in close communication with the governor as to the plans for our community. I think that we'll continue to need his support. We're grateful for the partnership on opening up our rapid testing sites through Walgreens. We're continuing to work with him and now a member of the state legislature on this issue. I know that the governor has moved forward on relaxing rules for elective surgeries or procedures in some hospitals. I've been in communication with the hospital leaders about that, and they feel that they have enough space of yet. My caution would be we have to continue watching those trends. You know, if the intake at hospitals, which right now is flat, it doesn't mean it's peaked, it hasn't come back down, but it's not rising. If that begins rising again, I think we have to take a very close look at that, because we have to ensure that those hospital beds can be available for people who most need them. But right now, the conversations with them is that is adequate. Now, in terms of other measures, we're working to see, maintain social distancing, whatever we do. So if the governor has instituted some options for retail pickup, we want to ensure, and I believe he's got those guidelines, ensure that folks aren't coming into contact as they're picking up their materials. Now, of course, we have to abide by the recommendations the governor issues, but we have to make sure that we're keeping people as safe as possible in those recommendations. For now, it means, limiting that contact. Obviously, people I see more and more wearing masks, and we're definitely headed in that direction. And look, it's just sheer math. The more people come into contact with one another, the higher the risk that those case counts are going to go up. We've not reached the peak yet. We haven't. It may still climb back up, but most importantly, it may come down. And we have the power for that curve to reach its peak and come down, at which point we will be in a position to begin lifting orders as long as we have the testing and we have the epidemiological capacity, which we're building. And so I would urge people to not relax their efforts, because if you do, this will only extend itself longer. Voy a repetir en español. El gobernador ha dado ciertas guías. Él y yo hemos venido trabajando en temas de más pruebas. Por eso establecimos las sedes de pruebas en Walgreens. Ahora tenemos a un representante estatal también liderando este esfuerzo. Entonces, realmente estamos colaborando mucho con el Estado. Sé que el gobernador estableció que ahora pueden seguir los procedimientos hospitalarios electivos, no solamente serán cirugías y procedimientos necesarios. He estado en comunicación con los líderes de los hospitales y ellos ven que esto no será un gran problema, ya que la curva de admisiones a los hospitales se ha aplanado. No significa que ha caído, pero al menos no está subiendo. Entonces hay que mirar con mucho cuidado. Si empieza a subir nuevamente esa curva, tal vez sea necesario reevaluar, hay que mirar pues con cuidado, pero en este momento está bien hacer eso de acuerdo a estos líderes de los hospitales. Lo otro que ha dicho el gobernador es está permitiendo que las personas recojan las compras de no solamente de comida, de supermercados, sino también de tiendas. Ahí también pues se urge mucho cuidado, no tener contacto, si es posible dejar las bolsas en el carro e intentar alejarse, porque es lo básico, lo que hemos venido diciendo. Entre más contactos hayan entre las personas, más posibilidad que va a seguir subiendo el virus. Hemos llegado a aplanar la curva gracias a todos ustedes. pero con sus esfuerzos vamos a lograr que esa curva caiga, que lleguemos al pico de la curva y con eso vamos a poder empezar a levantar órdenes siempre y cuando tengamos suficientes pruebas y el trabajo epidemiológico que necesitamos. Estamos trabajando en ambas cosas, entonces hay que seguir ese distanciamiento. Y si va a participar en estas actividades de ir a recoger algo, con la máscara. Cada día veo más gente con las máscaras. Estamos trabajando con el alcalde y se ve muy cierto ese siguiente paso y ya prácticamente todo el mundo usa máscaras, lo cual es necesario.
Pregunta de KXLN, Univisión. ¿Qué ayuda existe para los inquilinos que no pueden pagar su renta? Hemos escuchado de muchos que han sido desalojados, incluso les han pedido sus artículos de valor como garantía para la renta. ¿Qué ayuda existe? ¿Cuál es el mensaje para ellos?
Bueno, para los inquilinos que se están viendo amenazados por desalojo, recuerden, no tienen los dueños del edificio no tienen derecho de desalojar, ya que la Corte es la cual que implementa esos desalojos y las Cortes en este momento no están escuchando casos de desalojos. Sí sé que las personas van a tener que pagar su renta en algún momento. Cuando se levante la orden va a haber que tener que pagar la renta. Y ese es uno de los temas que está liderando el representante Wally y el líder, el czar, por parte de la ciudad, va a ser qué se puede hacer para apoyar más a las personas. Miren, no le vamos a poder solucionar el problema a todos. No existen esos fondos por parte del gobierno, pero sí estamos intentando expandir los apoyos lo más posible. El fondo de ayuda de COVID-19 que se estableció hace un par de semanas ya ha distribuido millones de dólares a familias de muy bajos recursos para ayudarles a pagar la renta. Nosotros estamos trabajando en qué más podemos hacer por parte del condado, la ciudad, el sector privado. Seguiremos explorando eso en el tiempo que queda antes de que se levante la orden. Y continúan esos retos económicos, pero esperamos con los fondos que vienen de distintos sectores poder presentar al menos alguna ayuda y por ahora extender hasta donde sea necesario la prohibición de desalojos que las Cortes están llevando a cabo.
Now from KTRK, what would the czar do and how would the czar's job conflict with the city of Houston czar?
The mayor and I have been working together on each of these issues around homelessness, around childcare, around access to funds for very basic needs. Both of us, for example, endorsed the Greater Houston COVID-19 Recovery Fund that was established. Millions of dollars already have been received to support people's individual needs, the most vulnerable families, and paying their rent, their basic necessities. So that's something we've been doing already. I am constantly on the phone with nonprofit leaders, private sector leaders, and so is he. We just wanted to make sure that this was even more coordinated, that we had a designated person representing the county and city with our full authority to carry this work forward, and that's why we're each naming a czar. He will name his later this afternoon. That is a coordinated role that he and I have been designing together for weeks. As I said, the work was going on. We knew we were going to name somebody at some point, and so now we've come to that point, and they will work very closely together. They will work to invite other leaders who formally need to be part of a group, of a council, and they will also be overseeing the efforts. This is not an honorary position. It is not a symbolic one. This is a position that will get things done, and so that's why I've named Representative Wally, who has a track record of getting things done for this community, and I know that the mayor's representative also has that track record. They very much complement one another, so we are putting together a stellar combination to drive our region forward.
Okay, KTMD, Telemundo also. A medida que todo regresa a la normalidad, ¿el usar mascarillas continuará siendo opcional o obligatorio como en los parques?
Primero, recordemos que todavía no estamos regresando a la normalidad. Recuerden la gráfica, está subiendo los casos en este momento, han llegado a un nivel plano, pero no significa que esas admisiones de hospitales vayan a caer. Si empezamos a regresar a la normalidad el día de hoy, ahí sí que no va a llegar la normalidad por unas buenas semanas o meses, porque vamos a empezar a ver otro incremento en el número de casos a los hospitales, en el número de muertes. Ya sabemos hoy 3 más muertes, eso no es normal. Ahora, a medida que sí empezamos a llegar a ese pico y empiezan a bajar los casos, lo cual con su ayuda será en las próximas semanas, a próximos días, esperemos, ya empezamos a salir más. Sí, necesitamos que se mantenga esa distancia. Vamos a estar tomando varias medidas. Cuando se abran los negocios, van a tener que practicar distanciamiento social. La verdad, no creo que vayamos a poder abrir pronto ningún sitio donde se congregue mucha gente. Eso se está evaluando. Y vamos, el uso de máscaras, muy importante. Sí, vamos hacia un camino, con el alcalde lo estamos diseñando en este momento, en el cual todo el mundo vaya a tener que utilizar máscaras. Simplemente en ese momento no hay mucha gente por fuera y la gente por fuera ya las está usando, y también queremos asegurarnos que antes de que volvamos el uso de máscaras, de que sea obligatorio, que hayan suficientes disponibles. Han habido otras comunidades donde se volvió obligatorio el uso de máscaras, no había máscaras y hubieron inclusive peleas entre las personas intentando encontrar máscaras.
KTRK, what will you reopen back in the county and when?
Can you repeat that?
What will you reopen back in the county and when?
So the question, I think, is about when we'll reopen the county.
And what will you reopen, like businesses?
And
type of
what?
businesses?
Got it. So the decisions as to lifting the order are all based on the data. They are not based on a deadline that we just decided, because it was a round number or the beginning of a month. It's not based on a feeling that we're all tired of this and we have to come back to normalcy. And the reason for that is if we make the decision based on our best guess, on a hunch, on an arbitrary deadline, then the cases will begin to rise again. We won't be prepared to contain those, and we're going to be right back where we were 3 weeks ago. And so what we're looking for, and the answer to when, is when we hit that peak and we're already well in toward the valley. If you look at the hospital admissions data, right now it's flat. The curve is moving in an area that's roughly flat. There's no evidence so far that the curve has hit the peak or that it's at a level where we would be able to identify new cases, isolate them, so that everybody can go back to work. And so we're working on that, Dr. Shah's team, round the clock, with my team, with the healthcare leaders, on ensuring that we have enough epidemiologists and systems to be able to identify folks who are sick and isolate them. But we can't do that if the new cases every day are so high and if we haven't hit the peak. And we just haven't hit it right now. So when? It will be sooner if you stay home. If you stay home, the new case count, the new admissions at the hospitals will continue to decrease and decrease until it's clear we've hit the peak and we're at a point where we begin opening things up. In terms of what we will open, those are the discussions that are going on right now. And one thing I can say with certainty, we won't be able to reopen mass gatherings, right, at once. It's going to have to be a phased approach. And so those are the conversations we're having. It will have to be tiered. We will have to be watching the data. And this will be a conversation that will probably continue going on for long after we begin lifting the restrictions, because we will always run the risk of that virus coming back. And so that's why when we reopen, and regardless of what we reopen, we're going to have to keep that social distancing. We're not going to go back to life as we know it, not for a while, probably months, maybe even longer, because the virus is still there. We've not developed immunity. We've not developed a cure or a vaccine. All we've done, and this is powerful, and it was your work, is we've stayed away from one another so that the contagion doesn't happen. But the minute we come back together, it will rise inevitably. And so we have to have a low enough rate that we're able to isolate. We have to have enough testing. We have to have enough epidemiologists. And we have to hit the peak, which we haven't hit yet.
KTRK, will Representative Wally be paid? Will he quit his law firm job, or will he assure that his law firm will not seek contracts in relation to any recovery dollars?
Yeah, Representative.
Sure, it's a great question. I will not be paid. This is an unpaid position. My law practice has nothing to do with, I do a lot of family work, so there's no conflict between my law firm and the work that I will do on behalf of the citizens of this great city and this great town. So, follow-up question, I'm sorry, what's the second?
It was regarding your law firm. If you will quit your law firm job and will assure that your law firm will not seek contracts in relation to any recovery dollars.
No, I don't. That's not the role. That's not my practice anyway. So we'll be okay. Well, there won't be conflicts of interest in that component.
Thank you so much, Representative. And yes, we've gone through and worked with the county attorney on any possible conflicts. I take transparency and ethics very seriously, to the extent, as folks know, I don't even take campaign contributions from anybody who does any sort of business with the county since the minute I was elected. So there is no shadow of a conflict of interest in the work that I do, and we've worked with Representative Wally to ensure that this position is solely about making sure that the community sees that relief and that recovery in the best way possible.
From KPRC, Mario Diaz, there's a report out this morning with regards to the rodeo and its closure. How much communication was there between the county and the city's health department in shutting the rodeo down? Officials were discussing how the virus can spread easily and its impact on the rodeo was expected. In hindsight, do you feel your office handled the situation properly?
Yeah, the rodeo feels like many weeks away at this point, and many tough decisions away. Because of the decisions we made, we saw a report about a week ago from Rice University that we saved already 4,500 lives. It's probably more at this point. And they were decisions that were unpopular. But as always, and I mentioned it right now, I don't make decisions based on politics. I make decisions based on science, based on data, and that means sometimes taking positions that are unpopular or that people misconstrue, and I'm okay with that as long as we are doing things right, doing right by the community. And so when the virus started, when we found out there was a case, and we were being told, let's wait until there's evidence of community transmission before we close the rodeo. And my sense was, guys, we're not testing enough. And so obviously there's probably community transmission, we're just not catching it. So I'd already made the decision, okay, today, I remember it was a Monday or a Tuesday, so today, if not tomorrow, we've got to shut this down, even if there's no evidence of community transmission. And coincidentally, the gentleman who ended up being diagnosed that had been to the rodeo cook-off and it was community transmission, that happened the same day. And so I feel that, as far as I'm concerned and my folks are concerned, that we were ready and making the decision regardless, just trying to be smart about the fact, look, if you're not testing, you can't just say, I'm going to wait for something to crop up. That's probably not going to. And the fact that we made the decision and we've had such a positive outcome compared to similarly situated communities, just shows that it was the right one. Now, I don't think it's the time, and there will probably be tomes written about whether what we did was right or wrong, and so that's why I tell the story of how everything came about, but really I don't think we will know for quite a long time. We're very much still in the thick of it. It may be that we still end up using the NRG shelter, for example, if the curve comes back up. We're not at a point right now of assessing whether what was done was right or wrong. We're at a point of digging in even deeper to continue with our efforts, because we are not through, not by a mile. We don't even know if our curve has peaked yet.
And just in that same matter, what, if anything, should have been differently?
What should have been done differently? At this point, I wish that from early on we'd had testing, but I've said that from the start. I mean, I'll always give it to folks straight. And that was, I'm just trying to remember, that was around the time when folks said, well, are we going to have testing tomorrow? How about the day after? How about the day after? I said, look, we won't, because the supply chains aren't there. There aren't enough reagents. There aren't enough test kits. There aren't enough cotton swabs. There just isn't enough of this in the country right now that we need to be able to do the number of tests we have to do. And I said that from the very start. And if we'd had the tests that we needed, we wouldn't have had to shut down. we would have been able to do what South Korea did and simply identify people who were sick and isolate those people. And I don't want that to happen again and that is why I'm asking for folks to help us out until we hit that peak. And in the meantime, we've done everything we can. We went from 2 test sites to 6 that Harris County helped bring together. The city of Houston, of course, doing theirs as well. We are working to ensure that those materials that we have in our fixed sites can be transported. That's really the obstacle we're facing right now, is we're not able to take the test kits, the materials, to the places where some folks need testing. And then we're working with our epidemiological teams to be ready so that the second time around, once we lift the order, so that then we can isolate and put ourselves in the best position to be able to identify cases, isolate them, and everybody else can still work. And so I don't want to have to use that big hammer again. We had to the first time because there simply weren't supplies available. The county was ready to open up 10 sites, and we had a system and we had a website that's worked fabulously, but we didn't have the materials because they just hadn't been available in this country until recently. So that will always weigh heavily. That's the reason our economy had to shut down. But right now we're still there. We still haven't hit that peak. We still haven't figured out how to match the testing exactly with the needs. And so help us out, stay home, help us hit that peak sooner. We will do it. If you stay home, we'll hit it quicker. We'll be able to begin lifting the order quicker. And we're working on our end to leverage the resources we do have so that we can identify and isolate folks as they get sick. But we can't do that if we have too many cases, if we haven't hit the peak.
Judge.
Yes, Dr. Shah.
Yeah. So, Dr. Amir Shah, Executive Director, Harris County Public Health Authority for Harris County. I just want to echo what the judge just said, that there are 2 bits of information that, in general, in terms of buckets that we're following. One is related to case counts in the community, which gives us really a breadth, if you will, of what the transmission looks like across the community. And the second piece of it is what's happening in the hospital system, which gives us really severity of who of the community who has been infected requires going to a hospital, and certainly from a hospitalization standpoint, if that means that they need to get to ICU care or be on a ventilator, that's when you start to have really the issues. These are the 2 buckets of information that we're following, and the judge is absolutely right. Early on, and even now, we still have one arm tied behind our back in terms of getting all the testing constraints out of the way so that we can have a better understanding of that first bucket, which tells us the breadth of what's happening, where it's happening, the transmission in our community. That remains a countrywide, a nationwide issue. That's not just for Harris County, it's not just for our region, it's not just for Texas, it's across the country. And what I wanted to emphasize, and this is what I really wanted to say, was that we have these sites that are available, and we have not hit that capacity over the last few days. Yesterday, we've had really bad storms. We couldn't even keep, we had to close the sites down because of the storms and the rain and the weather. So we're asking people to go to readyharris.org, readyharris.org, to go on the online screening tool. We want people to sign up to get tested. Again, we're prioritizing those with symptoms, but we recognize that there are people who...
As federal, state, and now local governments start to talk more about restarting the economy and what reopening will look like, the county judge, Harris County Judge Lina Hidalgo, announcing a few minutes ago, leading that effort for the county, the recovery czar, Armando Wally, a state representative since '08 from the Aldine area. He'll be leading the effort for the county. He will coordinate with the city's recovery czar. We'll hear that name from the mayor coming up this afternoon. Not a lot of details about exactly what these 2 people will do, but they will coordinate to make sure the recovery goes as smoothly as possible. You can continue watching this on our website or our mobile app. The News at Noon with Sherman Chow starts right now.
KHOU 11 News at Noon starts now.
Good. That capacity to help.
Yeah. Pues ya por último, la responsabilidad del representante Wally y qué representa esto para nuestra comunidad en el condado Harris.
La posición a la cual he nombrado al representante se encarga básicamente de la recuperación de esta crisis, pero también el aliviar, el intentar minimizar los impactos de la crisis en las familias. Hemos venido trabajando en temas de alimento, de ayuda de renta, de ayuda de cuidado de niños, también el estímulo económico que se ha hecho, las inversiones. Todo esto lo venimos haciendo en coordinación con líderes de negocios, de organizaciones sin ánimo de lucro. Yo estoy por teléfono todo el día con esas organizaciones, con el alcalde, pero quiero que haya una persona cuyo enfoque únicamente sea este. Nosotros estamos muy enfocados en la salud, en el salvar vidas, pero estas otras áreas son igual importantes. Entonces, él se va a encargar, va a trabajar con el representante de la ciudad, van a organizar un plan pues, de trabajo para asegurarse que estamos maximizando los recursos en todos estos temas y van a nombrar otros líderes comunitarios, a como ellos vean necesario, a un grupo de personas que van a trabajar en resolver esto. Este no es un título pues honorario, es un título de trabajo. Él viene a trabajar 100% en esto y mencioné antes, se ha evaluado ya el abogado del condado que no hayan conflictos de interés. Yo siempre trabajo sin conflictos, sin política. De hecho, en mi campaña ni siquiera recibo contribuciones de personas que tengan negocios con el condado. Desde el principio que llegué a esta posición he dicho, lo siento, no quiero ni siquiera que haya la apariencia de un conflicto. Entonces, espero que esto ayude a que la recuperación, que el alivio un poco sea todavía más eficiente. Thank you.
Gracias.
Gracias.
Thank you.